Now let's take a listen.
So with regards to COVID-19, we're going to start regular briefing for today. Today's briefing will be presented by Minister Bang Neung-ho from Ministry of Welfare and Healthcare. And we also have Tae-ho Yoon, Min Tae-lee present, and we also have Min Seok-yeon present with us today. And in addition, we also have Sung-soo Kim here. We're going to also present sign language translation as well. We're going to first hear from Minister Bang Neung-ho. I am the first Vice Head of the Central Disaster and Safety Countermeasures Headquarters, Minister Bang Neung-ho. As of July 26, as of midnight, in Korea, there were 12 newly confirmed community spread in Korea, and there were 46 imported cases. In total, the confirmed cases amount to 14,150 cases, and right now, 962 people are still being treated. On Friday, from Iraq, 293 people who were working there of Korean nationals came to Korea, and from them, more than 30 people were being treated at the life treatment centers. And for 215 people who actually tested negative, they're going to be put under 14-day quarantine, and before they leave, they'll also be tested once again. In hot deserts, they actually made many efforts to work there. So we believe that they really need rest, and we hope that they will get better soon. For Korean people who have come in, we are going to make the best of our efforts to treat them. In addition, for the temporary centers, those are centers that we made to keep our safety. So I want to emphasize that once more. So we want to ask for your understanding in installing such centers. Yesterday, we did not see an additional case of death, and until now, 298 people have passed away. Today, the government held a meeting under the leadership of Prime Minister Jung Se-kyun, and we talked about strengthening the measures for those people being confirmed on ships, and also measures for foreign people who are confirmed, and also about vaccine treatments as well. First, I'll explain about the assessment that we made on risk over the past 2 weeks. Until July 25th, for the 2 weeks period, 19.9 people on average were confirmed, and this was a decrease by 11.9 compared to the previous 2 weeks. And for patients with unknown causes, from 8.5% previously, it was improved to around 6.3%. And also for the control within our system, it is getting close to 80%. By regions, in Daejeon, Chungcheong, and Gwangju and Gyeongnam region, we are seeing a dramatic decrease in number of additional confirmed cases. And for metropolitan areas, we are seeing scattered outbreak, focusing on areas such as churches and daycare or long-term care centers. In Korea, it seems like we are controlling the newly confirmed cases that are coming from community spread, and we are able to control it well. However, in the metropolitan area, we are still seeing cluster outbreak. So this means that we still have to take caution as it is risky. So we want to ask the citizens in the metropolitan area to be careful. So please make sure that you're avoiding crowded and confined spaces, and please make sure to wear face masks and follow other personal hygiene matters such as washing your hands. Across the world, we are still unable to find where the peak is because we are still seeing a clear spread of COVID-19 across the world. And the number of total confirmed cases across the world has exceeded 15 million people. And by the day, the records are being broken, especially for the role model countries in Asia, including Singapore. We are still seeing another resurgence of COVID-19. And in such a situation, in order to mitigate the harm that has been given to the economy, many countries are releasing and lifting lockdowns. And with such external changes, we are seeing that there are increases in confirmed cases that are imported in Korea as well. Over the past 2 weeks, on a daily average, confirmed cases that were imported were 31.4, and this was an increase from 19 from the previous 2 weeks. For everyone who are coming in from abroad, they get tested and they are supposed to be put under quarantine for 14 days. Therefore, there is a low risk of this going into community spread. Right now, we are living together with COVID-19. And for our economy, we depend very much on the external situation, and depending on that, we cannot block ourselves from exchanging with external countries because this is important for the livelihoods of our citizens, and we have to make sure that we are not undermining the growth of the future. However, for those people who are coming in from abroad, if they are infected, they could put a burden on our health system, so we do have to strengthen the measure in regards to that. And for the infected cases coming in from Russian ships, as we can see from such a case, we do have to monitor and manage our health system. Therefore, we have talked about strengthening the measures for ships coming in from abroad. We are continuing to strengthen the measures even as of now. For people who are leaving or departing from the ships, whether it be Korean or foreigners, they get tested and we make it mandatory for them to be put under 14-day quarantine period. And starting on July 20th, we have said that for Russian ships that require repair on the ships, we are doing a test for everyone that is on the ship. And we are also increasing the countries subject to special entry procedures. And for people who want to depart their ships and come on land, they have to make sure that they submit the PCR test results. And we are making sure that we are testing everyone and we are only letting them unload the ship or depart from the ship when they test negative. So we're trying to minimize the risk. When foreigners come into Korea and if they are confirmed, we're also going to make sure that we improve the measures on treatment fees as well. Korean government is trying to make efforts so that we can actually diagnose people at the early stage. So starting until now, we have actually made sure that we paid all of the treatment fees for the foreign people as well. However, we believe that we have already achieved our goal for blocking infections coming in from abroad. However, considering that this could actually put a burden to our health system, we're going to strengthen the measures on treatment fees. The most important improvements are as follows. So for foreigners who are tested and who are tested positive during the quarantine stage, they'll have to pay for their own treatment. So first, we're going to make sure that we are going to apply these measures for those foreigners who are intentionally coming into Korea to be treated for free. And if we were to expand it later, we're also going to look into other foreigners. So we're going to make sure that we are monitoring this while making sure that our own Korean nationals get protected. And for health insurance, for foreigners who have stayed in Korea for a long-term period, of course it will be retained as is. So we're going to put a bill for adjustment, and once this amendment is approved, then we're going to go through with the details. Next, I'll explain about the treatments and vaccines. Right now, there are vaccine candidates across the world. They are going through clinical testing, and there are around 23 of them. And they are going through many tests to be approved. And there are many research ongoing in expansion with this. And starting from the second half of this year, focusing on major companies, many companies will also start clinical tests such as antibody testing and etc. We have to make sure that we are finishing our vaccine development. So we are striving hard with that goal. For vaccine vaccine in Korea, we are actually targeting completion for the second half of next year, and many biology companies, including SK Pharmaceuticals, is also participating. And for domestic vaccines, the National Health Center is targeting second half of next year to develop vaccines, and they are also researching on antibody testing, and we are going through 15 clinical testings which have been approved. WHO has said the following. So they said for COVID-19, they will be supporting the development of vaccines and cures. So they have launched the Act A, and they are actually giving out props that are necessary for it. So the COVAX facility installation was proposed by them, and starting on July 20th, 77 countries, including Korea, said that they are willing to participate. On June 3rd, the Korean government made an announcement with regards to vaccine development system, and we are going through with a two-track system. In order to develop cures and vaccine very quickly, we have to make sure that we support regulations so that we can actually develop these very quickly. In addition, we are also promoting the Public Vaccine Development Center, and we're trying to expand infrastructure in relation to that. For plasma treatment, we are expanding the securement of plasma, and we are also going to mitigate any difficulties with regards to equipment of research. We're trying to also secure as much equipment as possible as well. So we're going to have cooperation together with Ministry of Foreign Affairs, and on July 21st, SK Bioscience and Ministry of Welfare and Healthcare and another company actually signed a trilateral contract so that we can secure the material necessary for vaccines. So we are coming up with such a cooperative body. In addition, for remdesivir, we're trying to secure it additionally. And for medicines that have been approved for safety, we're going to make sure that we secure those as well. COVID-19 is still spreading across the world, and it is exacerbating. So in Korea, it is at a sort of stable level. However, we still have to take precautions. So I feel responsible for this as well. However, until now, we have responded to small and big changes that were brought on by COVID-19, and we were able to show confidence and trust for one another. As you have done so until now, please make sure not to be nervous. Please trust one another, and please do what you can do in your own place. And if you were to do so, we will be able to live together in our normal daily lives. Summer vacation is starting soon in earnest. I hope that you'll be able to stay safe. So in order to do so, please refrain from visiting closed and confined spaces. And please make sure to follow rules on personal hygiene. The government will also make efforts so that we can mitigate spread of COVID-19. And at the same time, we're also going to make sure that imported cases do not spread to community spread. Thank you.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at the top of the hour.
With social distancing measures getting updated,